Okay, folks, so we will get started. Okay, so welcome everyone. Good morning. Thank you for joining us. My name is Tina O. I'm an organizer with No One is Illegal Halifax Chubuktuk. I'll serve as the host and moderator for today's press conference on the very urgent need for action from the Nova Scotia government to end the barriers in migrant vaccine access. As a grassroots group organizing towards migrant justice, it is important for us to recognize that our organizing takes place in Mi'kma'ki, the ancestral, the unceded, unsurrendered, and continued future territory of the Mi'kmaq. We are committed to learning, taking leadership, struggling in solidarity with Indigenous-led resistance to ongoing colonization, deep-seated racism, and threats to their sovereignty. Our dedication to migrant justice on Mi'kma'ki is to uphold Indigenous self-determination, their sovereignty and rights whenever they are under attack here and everywhere. So with that, we officially begin our press conference. We're here today because we know that migrants are being left behind in the Nova Scotia vaccine rollout. We know that they are being left behind because they do not have access to public health care, which is tied to their precarious immigration status. Before I introduce the experts on the panel today, we would like to show a short video recently launched earlier this week of community members demanding a safe, accessible, and just vaccine plan that leaves no one behind. So I'll just play that video there.
Government officials encourage everyone to get vaccinated to protect against COVID-19. Migrant community members are being shut out by overwhelming barriers in Nova Scotia's vaccine rollout.
These barriers reflect ongoing and pervasive gaps in healthcare access for migrants, including people without migration status, refugee claimants, international students, and migrant workers. But these barriers are not inevitable nor justifiable and must be addressed immediately to leave no one behind.
We are calling on the Nova Scotia government for a vaccine plan that is safe, accessible, and just to include all members of our communities.
Will you join us?
Along with many others, we are demanding accessible vaccine sites, including mobile vaccine clinics for migrant workers, and designating the Newcomer Health Clinic in Halifax as a vaccine site for all migrants. A guarantee that there will be no sharing of personal information with immigration officials.
Time off without loss of pay for vaccine appointments. Accessible vaccine booking for all by opening the online booking system to people without Nova Scotia health cards to ensure they're not last in line to receive the vaccine.
Commitment to ensuring that migrant workers who want the vaccine can access 2 doses before returning to their country of origin. Protection from employer coercion and reprisals for those who do not decide to get the vaccine. Educational information that is culturally relevant.
Join us in taking action to end barriers to vaccine access for migrants by contacting the Nova Scotia Minister of Health using the link in the caption. And be sure to follow us on Facebook, Twitter, and Instagram to stay updated.
Vaccine access for migrants.
Now!
Okay, so today we're joined by experts in their field to lay out a safe, accessible, and just vaccine plan. First, we have Stacey Gomez of No One is Illegal and member of the Migrant Workers' Rights Working Group. Then we have Shiva Nurpana, board member of the Halifax Refugee Clinic and adjunct professor at Dalhousie and St. Mary's University. Our third speaker, we will play a video from Tari Jojidi, PhD candidate of political science at Dalhousie University. Last but not least, we'll welcome Dr. Monica Dutt, public health and family physician of the Ally Center of Cape Breton. Once all speakers have spoken, we will then start Q&A with media. The cutoff time will be between 11:30 to 11:45 a.m. We ask that media type up their questions at any point of this press conference using the Q&A function on Zoom, and then we will be ready to begin. Off to you, Stacey.
Thanks, Tina. And hi, everyone. So yes, as highlighted in this video with community voices, we are calling for immediate action on the part of the Nova Scotia government to ensure a safe, accessible, and just vaccine plan, which does not leave migrants behind. This includes people without immigration status, refugee claimants, international students, as well as migrant workers. And specifically, as was mentioned, we recognize that the root of unequal access to the vaccine is tied to a lack of access to public health care for migrants, as well as inequalities tied to precarious immigration status and racism. We continue to call for full and permanent immigration status for all migrants. So specifically, our work has included advocacy, direct support with migrants, as well as education of the public and with migrants. So I'll be speaking from that perspective today. So there are many examples of the barriers that we're seeing that are facing migrants who wish to get the vaccine. So for example, while Nova Scotians are able to book their vaccine appointments online, migrants without health cards are required to call a number to book an appointment. They face many barriers in doing so, including not being able to get through sometimes because the waits are so long wait times, and then lack of appointment availability due to this wait. In addition, it's difficult to navigate this system when you call in, it's in English, though interpretation, I've been told, is available. However, interpretation is very limited in vaccine appointments. So interpretation during vaccine appointments is only available in 1 of 10 community clinics across the province. In short, we're calling for improved vaccine access for migrants by opening the online vaccine booking system for all, as well as hosting clinics where prior registration is not required, as has been done in Ontario for migrants. We're calling for protections against the threat of deportation, which Tari will speak about. And we're also calling for a guarantee that interpretation will be available regardless of where migrants access their vaccine. From our work with migrant workers, specifically through our migrant workers program, we know that migrant workers in the temporary foreign worker program face specific barriers with regards to the vaccine. Most live in rural areas, can face language barriers, and often do not have phone service. Many are also particularly vulnerable to COVID-19 because they live in congregate settings. And this is because according to their contracts, they must live with their employer in employer-provided housing. So moreover, they are on closed work permits, which means that they are tied to one employer. And this makes them particularly vulnerable to employer abuse. The Nova Scotia government is relying heavily on employers to book vaccines for migrant workers, which increases the risk of coercion and reprisals in some cases. Migrant workers should be able to make their own health decisions freely, as Nova Scotians are able to do. That's why we're calling for mobile vaccine clinics for migrant workers so that they can easily access the vaccine if they want it, free from employer interference, as well as a commitment to ensuring that they can access both doses before returning to their home country. At the same time, we need measures to prevent employer coercion and reprisals in cases where they opt not to receive the vaccine. And we also need a stopgap until then. We need to have a contact person in the Department of Health and Wellness who is willing and able to book vaccines for groups of workers. I reached out to this department to ask for their support in booking the appointment of groups of workers who've reached out to me who want to get the vaccine, and they've declined to support. So in closing, we're calling for vaccine access for all migrants who want it, healthcare for all, as well as full and permanent immigration status for all. Thank you. And I'll now pass it to Shiva.
Thank you, Stacey. Thank you, Tina, for organizing this event and really crucial timing. And thank you for inviting me. So in my capacity as board member of Halifax Refugee Clinic, I've heard from staff who work daily with refugee claimants who actually do have government health care provided by the federal government, but they're still not able to access vaccination appointments in the in the smooth, facilitated way that is available to Nova Scotians living in Nova Scotia who have MSI cards. And the key distinction is, of course, holding an MSI card or not. And this has proved to be, and the online booking has proved to be, as you know, kind of repeating what Stacey says, for people on precarious status such as refugee claimants, it's proved to be a huge barrier. And in talking to the settlement officer at Halifax Refugee Clinic, the language barriers, the fear barriers of, you know, talking to officials and trying to navigate that system. And I want to highlight how experiencing healthcare as a barrier, that in itself, like, healthcare should absolutely not be tied to migration status. And that is, and to decouple them, to provide equitable coverage, MSI, for whoever is residing in Nova Scotia, that's simply smart policy. And it's to all our benefits, not just the benefit of underserved populations who happen to be in Nova Scotia, by ensuring that people can access vaccinations in timely, in efficient, in barrier-free manners. We're helping society as a whole. And if there's one learning lesson from the pandemic that we need to take, like, this is the moment to think about smart policy and how we can put in place these policies which will ensure that everybody in society, like, it's a cliche to say at this point, you know, that the virus affects us all. It does. Guess what? And that is why public health, and at this point, I do think it's important to mention, as reflected by staff at Halifax Refugee Clinic, that the barriers have decreased. Like at the beginning, when the vaccination appointments started, the vaccination kind of infrastructure was implemented in Nova Scotia, there was a clear message that non-MSI holders cannot access vaccines, and that was rectified. You know, but again, it took a lot of advocacy, it took a lot of push, and, you know, why does there need to be this, like, fierce advocacy, to use a cliche, to ensure that people are getting the healthcare that is crucial to all members of society, not just their peer group or not just their social population. So, you know, we're very conscious that Nova Scotia has performed really, I think that's, you know, that's acknowledged globally. You could say that Nova Scotia, the Atlantic provinces, have performed really well with regards to public health and compliance and all that. And I think that's important to be noted. But at the same, and, you know, our frontline workers have, again, to draw on a cliche, but it's true, have been absolutely heroic in working with people. Our Nova Scotian people have been really compliant, and I think some of that compliancy comes from a place of knowing what the healthcare system capacity is in Nova Scotia, knowing that we simply cannot afford to, you know, go there. So people have been really good about compliance and, you know, and keeping things in check. But, and, you know, we're thinking about the way forward here, what needs to be rectified short term, but also long term, in terms of thinking about all these bureaucratic barriers which are constantly being, and this is like an example of a urgent, you know, really present, crucial barrier right now, access to vaccine for people on precarious status. But I really want, you know, people to be aware that every step of the migration journey is almost experienced as a barrier. We need advocates, we need people at every step to kind of facilitate moving these barriers, moving this bureaucracy. There are all sorts of reasons why we have this kind of intense, extreme bureaucracy in place, and now is not the time to go into that. But I'm really, I really encourage us all to think about that and think about using this moment as a way forward to a fairer society. And with this, I've got the warning. I'm going to turn it over to Monica. Not Monica, sorry, to Tina. Thank you.
You're on mute, Tina.
Sorry, just give me 1 second here. We're going to play a video by Taria Jodi.
Hello, my name is Taria Jodi. I'm a board member with the Health Association of African Canadians, as well as with East Coast Prison Justice Society. I'm throwing my support behind No One Is Illegal Halifax's Vaccine Access for All campaign. I call on Minister Zach Churchill and other provincial leaders to ensure that all migrants, regardless of immigration status, have access to vaccines in a safe and just way. This includes a formal guarantee that information will not be shared with the Canada Border Services Agency, ensuring that vaccines are available in the newcomer clinic, as well as in mobile vaccination clinics, and protections for migrants from employer reprisals. A crucial part of health equity and the ability for us to end this pandemic is the capacity for every person who wants it to be able to access a vaccine, and for those processes not to lead to interactions with other state institutions like the Canada Border Services Agency that cause harm. By forcing people to disclose information and setting up barriers if they do not have a health card, we run the risk of undermining trust in the health system at a time when we need to encourage everyone to get vaccinated. We also run the risk of exposing migrants, residents regardless of immigration status, to harm and stress, which may have further health implications in the future. We cannot allow unreasonable and unnecessary barriers to access to undermine migrants' opportunities to get vaccinated. We have the means, we have the vaccines available. We need government to ensure that every person in this province is able to protect themselves from this virus.
Okay, thank you. So we will now pass it to Monica, our last speaker. You're just muted, Monica.
Oh, I thought I had it all set up, so I think I'm good now. Yeah, so thank you. Glad to be joining you from Unama'ki or Sydney, Cape Breton. And speaking as someone with a few different connections to the COVID-19 vaccine and the pandemic more broadly. As a healthcare worker and community member, I am profoundly grateful to have received my first dose of vaccine, and I want every resident of the province to feel the same ease and safety when getting theirs. As a family physician, I speak to many people who face barriers to obtaining a vaccine, whether through lack of documentation, transportation, literacy, and other factors. And as a public health physician, I have been involved in working to ensure that vaccines are as accessible as possible, but I know there are gaps. And all of this work is in the broader context of knowing that those who are migrant workers or who have precarious immigration status are amongst the highest risk of both acquiring COVID-19 infection, as well as suffering poor health outcomes from the infection. And we've seen this in the high number of workplace outbreaks in Nova Scotia and across the country, including the largest workplace outbreak in a meatpacking plant, where there are a category of workplace where there are often migrant workers. This has also been seen with farm workers who have become ill, and some have died, and many are unable to advocate for their rights because of fears about their jobs and immigration status. And we've seen racialized and minoritized workers in low paid, uncertain jobs also put at higher risk because they are deemed essential, although the lack of supports like paid sick days don't acknowledge that importance. And there are many other situations, including international students already struggling with financial and family stresses who acquire the infection and live in conditions where they cannot properly isolate. I've long been an advocate for truly universal healthcare, a system where every person has access based on their need, not based on their ability to pay or their immigration status. However, immigration status has become connected to the pandemic response because of the strengthening of border restrictions, both federally and in all Atlantic provinces. This has both served us well in terms of helping to prevent the spread of COVID-19, but has also meant greater scrutiny and often stigma for those who do enter the province, particularly for those who are racialized. This is happening against the backdrop of borders themselves, often perpetuating colonial and racist worldviews, primarily in terms of who is allowed in and who is kept out and why. But all of that being said, once someone is in the province, healthcare should not be a place where immigration status should matter. Or rather, it should matter, but for these reasons. Firstly, because we recognize that those with precarious immigration status are at higher risk of acquiring COVID-19, and we need to do all we can to ensure anyone who wants a vaccine can get one. And secondly, because extra steps need to be taken to ensure access that is supportive and safe for all, whether that means ensuring translation, explicitly stating that border enforcement or police will not be contacted by healthcare staff, or providing vaccines in convenient locations and convenient times. It is important that Nova Scotia has made the commitment to ensuring all residents will have access to the COVID-19 vaccine. We need this both for the health of the province and, most importantly, for the health of the individuals who are often bearing the biggest impact of COVID-19 illness and death. We owe that to them. Thank you.
Thank you so much, Monica. So thank you to all the speakers. We will now start Q&A. Again, I ask that media direct their questions to a specific speaker, and we will start with actually 2 questions. So Adrian, feel free to ask your questions back to back. We'll start it off with you. Please direct your question to a specific speaker. Just give me 1 second, I'll give you permission to speak. There you go.
Hi, can you hear me?
Yes.
I'm sorry, I don't really know who could answer the most accurately to my question. So I will just let you decide who would want to answer. I just wanted to know if you could give us an idea of how many people are directly impacted by these barriers right now. Are we talking about hundreds or thousands of people? Thank you.
Thanks, Adrian. I'm happy to start us off in responding. So in terms of the numbers, each year, approximately 2,000 migrant workers come to Nova Scotia to work in the agriculture and seafood sector. I think from my perspective, all migrant workers are facing some form of these barriers. For example, there has been the translation, though it was just a few weeks ago that the government translated information on the vaccine into different languages. The vaccine rollout started months ago. And so that's, you know, kind of something like the information that's available, but, you know, farm workers might have kind of challenges with literacy, for example, like what's being done to actually directly reach out to them, maybe to like have workshops that are culturally relevant, for example. I haven't seen the government do that. So just as one example, and yes, there are other barriers that are also faced like pervasively by migrant workers around the vaccine.
Can I follow up with another question?
Yes, yep.
You've alluded to it, but I understood that in the early phases of vaccination, the government said that they would vaccinate temporary foreign workers. I don't know exactly if it happened and how. So could you tell us if there was actually a vaccination campaign for temporary foreign workers?
Thank you so much for that question. I think it's an important question because months ago, the Nova Scotia government said that they would prioritize vaccine access for migrant workers, and we have not seen that happen. And so I will say also the National Advisory Committee on Immunizations does recommend prioritizing migrant workers, recognizing that they're uniquely vulnerable because they live in congregate settings. And so this is why, you know, we've been pushing for months and months now for the government to take urgent action, and we haven't seen that happen. So no, the prioritization didn't happen. What happened, instead of having a concerted and targeted outreach campaign, like including mobile vaccine clinics, which is what we're calling for, migrant workers were asked to book when their age group came up. So there was no prioritization. And as I mentioned, migrants without health cards must call the booking line. Many migrant workers do not have a phone service, for example. And there are also many other barriers, including appointment availability is limited and so on. and the other barriers that I mentioned. But we have not seen that prioritization, and we've been calling for that prioritization to actually happen. Thank you.
Okay, so we have a question from Robert with Nova Scotia Advocate. Give me 1 second here. Oh, it says, Robert, that your Zoom is an older version, so I cannot turn on your microphone, unfortunately. So I will just reframe I'll just ask the question that you typed out. But before I do that, I'm so sorry. I'm just wondering if the other panelists wanted to address Adrian's question as well.
So speaking for Halifax Refugee Clinic, we currently, my understanding is we have over 100 active cases at that clinic, but that doesn't mean that every single one, because, you know, again, talking to staff members there, they simply don't have the capacity to proactively call each and every client that they have to, you know, see how they are with the vaccination process. If clients reach out to them, then absolutely they will advocate and, you know, facilitate their appointments, but the capacity simply doesn't exist to be able to do that proactively. Regarding broader statistics of, you know, as mentioned, because these are different categories, it's really hard to get a handle of how many precarious status people there are generally, because we're talking about spouses of international students who are on visitors visa, we're talking about temporary foreign workers, we're talking about people at different stages of their refugee claim with a work permit, without a work permit. So, you know, we do get asked these questions regarding statistics. It is, you know, outside of what's in our immediate agency, it's harder to get that kind of broad picture, but yeah, it could be in the thousands in Nova Scotia for sure. With regards to Robert's question regarding response from the province, so we did witness this, again, to start on a positive note, we have witnessed this change from the language that was at the beginning of the infrastructure, you know. And I would say I've noticed the way with the government responses work sometimes is they might not be responding directly to concern, but it kind of gets filtered down later, you know, through a different kind of avenue that seems to be the preferred manner of work. But we have raised these concerns in a very articulate, you know, we have written advocacy letters, a collective of, you know, people on this call and others, scholars, activists, and so on, directly to the province. And we're hoping that, you know, continuing that conversation, continuing to press for greater equity, greater access, that's I think we can be all on the same page with regards to that.
Thank you, Shiva. So Robert's question, just to rephrase that again, is curious about how responsive the province has been, if and when you contact them about these concerns.
Thanks. Can I respond? Thank you. So yes, as Shiva mentioned, for example, 2 months ago, organizations such as the Halifax Refugee Clinic, known as Legal Halifax, ISANS, as well as other organizations and medical professionals, sent a letter to the Nova Scotia government calling for improved vaccine access for all migrants. We received a response only, I think, maybe about a week ago. And unfortunately, their response doesn't address really many of the concerns that were raised. Also, you know, we are here talking about vaccine access for all migrants, but they really only responded about migrant workers, and they didn't, you know, give any commitment to actually improving the situation or responding to the calls that we've been making. So that's one example. We also, through the Migrant Worker Rights Working Group, specifically sent a letter to the Nova Scotia government about barriers facing migrant workers specifically, and we received a response last week also. And unfortunately, similarly, there was no commitment to improving the situation. Also, I have personally been in touch with many officials, including most recently with the Department of Health and Wellness, when workers reached out to me saying that they would like to book their appointments. And as I mentioned, there's many barriers. So we're supporting workers who are reaching out to us and accessing the vaccine. I reached out and I asked, like, would you be able to support? Because there's challenges with, there's a lack of vaccine appointment availability when workers are actually available. And I also asked for support with transportation, and they declined to support. So we, as I mentioned, we are calling for mobile vaccine clinics for migrant workers in proximity to where they live and work, where they can access the vaccine free of employer interference. However, as a stopgap, I would like to be able to be in touch with the Department of Health and Wellness, to have a contact person that I can reach out to that can help, when there's a group of, for example, 10 migrant workers who would like to get vaccinated. I think that's a pretty simple ask. And unfortunately, we haven't had a lot of, receptivity so far. I do, as Shiva said, I do appreciate the work that's being done by frontline staff. I appreciate the officials that are responding back to us, but we do need a commitment and action immediately to actually improve the situation. Words are not enough. Thank you.
Thank you, Stacey. So we have a question from Shannon. Questions directed to Monica. I will turn on your mic and you can ask the question.
Okay, thank you, Tina. My question is directed to Monica. I was wondering if you could elaborate a bit more on how immigration status impacts migrants' access to healthcare, aside from this specific issue with the vaccine, but you talked a little bit about the general issue. I was just wondering if you could elaborate a bit more on that. Yeah.
Yeah, there's a whole host of reasons. So if people do not have access to provincial healthcare coverage yet, for a range of reasons, they may get charged when they do try to access healthcare. Many people may not seek healthcare in the first place. One, because they may be worried about fees. They may be worried about whether they might be reported if they don't have documented immigration status. They may be in workplaces where they may be nervous about wanting to share any kind of health problems or report that to an employer, which they may need their support for to access healthcare. And this is a whole range of different people and workers. It could be also, students who, may not have the same access to different types of healthcare coverage. Often they are, for example, required to get private insurance. So it is a different tier of requirement for a resident in the province that they may not be able to access healthcare as they might, as anyone else in the province would. They need to have different costs for being able to acquire that care. And then even when people who do seek care, there could be fears around being discriminated against, and that does happen. Racism, as has been talked about quite a lot lately and should be an ongoing discussion, does exist in healthcare as anywhere else. So people are often worried about how they may be treated in the system. There might only be parts of their care that is covered. So they may be able to access some services, but not others. Sometimes, a healthcare worker or physician might support aspect of the care, potentially, out of pocket, voluntarily, but that might only be one piece of the care and not the comprehensive care that they need. And then if there's follow-ups, cost for medications or other types of treatments they may need, they might not be able to access all of those pieces. I don't know if anyone else has anything more to add around what they've seen with kind of the different types of status that people might have and different barriers that exist for the different groups.
I mean, just to confirm what Monica was saying, you know, for people who are no status, you know, the barriers in accessing healthcare are extreme. We're talking about, you know, people just not like sitting in an apartment waiting for results of, say, a humanitarian and compassionate appeal, which might go on for 18 months without healthcare. It's not it's not okay for our society today. It's absolutely not okay that we should have a population of people in this situation. Again, you know, talking about women who came here on visitor visas, their relationship fell to pieces, as sometimes relationships do. They're here because of their children, but they don't have status. They're not. So in a way, refugees and refugee claimants are the lucky ones, if I can use, because they do get some sort of status and they do get like healthcare coverage through federal programs. Migrant workers are generally have private insurance arranged through their employer and so on. But I do want to point out that there are a group of non-status people who are in an extremely precarious position in Canada and elsewhere across the world who do not, and it's morally unacceptable, and it's a health hazard for all of us, again, as I think the pandemic showed us. With regards to, I see a question from Eloise. I just quickly wanted to touch on that. So, you know, in talking with Halifax Refugee staff, number one would be to make the vaccination appointments accessible online for everybody, not make it, and we were thinking it might even just be a technical issue, but it does come across as a barrier. It is experienced as a lived barrier to accessing. She was actually texting me right now saying, I'm getting calls right now about people unable to access and unable to call or unwilling to call, and you know, so that would be like in the short term. In the medium term, providing MSI coverage, you know, and then in the long term, what Stacey talks about. So yeah, that's kind of my short term, medium term, long term advocacy plan.
Thank you. I just wanted to mention just some quick points. So, for example, as Shiva mentioned, migrant workers have private insurance, but in some cases, like I've seen employers withhold the insurance card, for example, and they're not, you know, really provided any information on what's actually available. And so definitely still many challenges for migrant workers who have health issues. So just to name that. And yes, with people without migration status, going to the hospital, they could have fear of being deported, for example. And so, yes, we continue to urge the Nova Scotia government for healthcare for all, regardless of immigration status. And then, Tina, I don't know if you read the question from Eloise, but I'm happy to respond as well.
I have not. So Eloise from Radio Canada, I will allow you to speak and you can ask your question. We will most likely end the press conference with your question.
Hi, yes. So a couple of my questions have been asked already, but maybe I'd like to hear you on, I guess, what would be the single most important thing to help the migrants get better access to vaccine? And then my follow-up is just, I'm trying to get a better idea of who are these people who don't have access to the vaccine. So you're talking about migrant workers, but can you kind of give us an idea of like, who are these people? When did they get to Nova Scotia? Like, kind of like, is this a seasonal thing? Like, are we talking about temporary foreign workers? Are we talking about something else? Just to kind of have a better idea of who's impacted by this. Thanks.
Thanks for your question. So yes, in terms of your first question, in short, so yes, I agree with Shiva around opening the vaccine booking line. However, I think simply whoever wants the vaccine should not face barriers to accessing it. So for example, for migrant workers, we are calling for mobile vaccine clinics for those who want the vaccine. Migrant workers and all migrants should not face reprisals around the vaccine. So for example, if they opt not to receive the vaccine, they should not be face threats or coercion. So for example, some have been told that if they don't get the vaccine, they won't be called back next season, or that they'll be sent back home. And Nova Scotians have the right to make a public their own health decisions, and so do migrants and migrant workers. So just to answer that question, and also because there has been a delay in getting the vaccine to migrant workers, we're concerned that migrant workers may not have access to both doses. And this is concerning because in their home country, in the global south, access to the vaccine is limited. And so, it would be responsible for the government to make a commitment to ensuring that they can have both doses if they do want it before they go back. And also, we don't, when we talk about migrant workers, we do use the terminology migrant workers rather than temporary foreign workers. But yes, we are talking about the same thing. Here's the reason why. Because there's some migrants that have been coming to Canada for migrant workers. There's some migrant workers who've been coming to Canada for 10 years, 20 years, 30 years. I've heard some migrant workers have been coming to Canada for 40 years. And so, they're not temporary, they're members of our communities that are here for oftentimes the majority of the year. They can be here up to 8 or 9 months of the year if they're part of the seasonal agricultural worker program. And just in terms of demographics, we're talking about workers from the Caribbean, primarily Jamaican, as well as Latin American, specifically many Mexican workers in the agriculture and seafood sector. And they're essential members of our community. They're also essential workers. We've seen essential workers be prioritized for vaccine access, but why have migrant workers who are essential workers have not been prioritized for vaccine access? So I hope that answers your question, Eloise.
Yeah, it does. Thank you.
Okay, so I believe that is the end of our questions there, unless actually Shiva or Monica wanted to respond to this follow-up. No, okay, perfect. So yes, that concludes our press conference. Thank you so much for joining us today. We just wanted to reaffirm that we are asking the public to take action to end the barriers to vaccine access for migrants by calling, emailing the Nova Scotia's Minister of Health and Wellness. You can go to our website at migrantjusticens.ca, where you will find instructions to take action, as well as more other details of the work that we're doing. Thank you so much to the speakers. Thank you to media for attending. Have a great day.